Dr. John Torres on this Facebook Live, bringing you headlines for the week and then answering questions that you might have. So if you have questions, please send them our way. I try to get to as many of those as I can, and they're always fantastic questions. But on top of that, I like to start off going with the headlines that you've probably heard over the past few days and getting a little more in-depth behind those headlines so you have an understanding of what the actual story means, and more particularly, what it means for you, your family, your loved ones, and your community, how it can help you get through this pandemic and hopefully get through it sooner rather than later. So let's start with the headlines. And the first one you've probably heard about, the one that's been in all the news over the last couple of days, is the Moderna vaccine. That's the second vaccine that has gone to seek an emergency use authorization from the FDA. If you remember last week, Pfizer with their vaccine, these are COVID-19 vaccines, actually sought their emergency use authorization from the FDA. They got the emergency use authorization, and then the CDC came out with their recommendations on how to give it. The CDC said, and this is what the authorization was, for children, for adults 16 years and older. So they dropped the age down to 16. And then the CDC said, okay, for this one, we want to go through what we call phase 1A, which means that those that work directly with COVID patients, and in other words, healthcare personnel, and those in long-term care facilities should be first in line to get this vaccine. And then at that point, the vaccine began to be distributed across the country, and it was sent to a variety of locations. And I believe by the last number, it was a little over 300, a little under 400 locations around the country. Now, fast forward to this week. This week, almost a duplicate of what happened last week. Yesterday, VRBPAC, which is the Vaccines and Related Biological Products Advisory Committee, that's the committee that advises the FDA on whether they should move forward with things like approvals or authorizations, whether they should do that. Yesterday, the experts, and this is a panel of independent experts, they're not employed by the FDA, they're put on this panel by the FDA so they can give them advice. And what typically happens is the FDA sends a question to them and says, hey, here's the question we have, give us your advice on the question. And the question they had is, are the benefits of getting this COVID vaccine more than and older, particularly thinking about the pandemic and what's going on with our pandemic. And what they said is, at the end, yes, it was a 20 votes, so no votes in this one. There was one abstention during this time. What they found out is that they went through a variety of data that they had gotten from Moderna. They've been looking at the data over the past couple of weeks, and they found out it basically is looking a lot like the Pfizer vaccine. It works in similar fashion. They're both mRNA vaccines, but they work a little bit differently in how they deliver it. And particularly, there's a thing called a lipid, which is a fatty molecule that surrounds that snippet of genetic material that goes in there that actually gets the immune system to develop those antibodies. Those lipid systems are a little bit different, which might have something to do with looking forward as far as allergic reactions. I'll talk about that in a minute. But they also went over some other detail, which is pretty interesting. One of the ones they wanted to know is what happens with viral transmission, because both with the Pfizer vaccine and with the Moderna vaccine, they studied disease. So in other words, they gave people these vaccinations. In Moderna's case, it was 22,000 people that got the vaccination over a study of 44,000 people. So 22,000 got a placebo, 22,000 got the vaccination. For Moderna, it was 30,000, so it was 15 and 15 that got the vaccination or placebo. What they looked at is how many people developed COVID-19, the actual disease, not whether they had coronavirus, not whether they were asymptomatic, but whether they developed the disease. And they found out that the vaccine, in Moderna's case, 94.1% effective at preventing you from getting COVID-19. With Pfizer, it was 95%, so they're basically almost equal. But what they didn't know, can this prevent you, if you're asymptomatic, have no symptoms but have COVID-19, from spreading the virus? They didn't know that at this point because that's not what they studied. They were trying to save lives basically. And so what they're doing, and they discussed this in the panel yesterday, is they're moving forward with studies on looking at this transmission, because that would be the endpoint we're really looking at. One, saving lives, reducing disease burden, but also reducing that transmission to get the pandemic under control. And so they're moving forward with studies there. However, it's a bit more complicated than that, because if you're listening to the VRBPAC meeting, they were also wrestling with the ethical issue of what do we do with those, both in the Pfizer and Moderna trials, who ended up getting placebo. Should they be first in line to get the vaccine? Some of the researchers said, yes, they should. We should open up the trial. We should basically look at all the data, what we call unblinding the trial data, and see who got the placebo and offer them the vaccine. Other researchers said, not so fast. If we do that, then we're not going to be able to follow forward with the trial to find out if it actually reduces that transmission of coronavirus, which is extremely important to ending the pandemic. And if we just wait a few weeks, maybe a month or so, then we can go ahead and understand better about transmission. And so they're still working that out. That was not the question they were answering for the FDA, but it was a question that certainly cropped up on top of that. And they also looked heavily at the allergic reactions. If you remember with the Pfizer vaccine, initially, and last week I talked about this, there were 2 reactions in the UK of healthcare workers who got allergic reactions. Both of those had carried EpiPens with them on a usual basis. They had severe allergic reactions to other things, and they had severe allergic reaction to the Pfizer vaccine. Both were treated very well, both ended up doing fine, and both ended up fully recovering. Now, with the Pfizer vaccine, once it started getting distributed here in the U.S. and people started getting shots, there were 2 actually in Alaska that had similar type allergic reactions. Don't know the full story behind them as of yet. They're researching into that. But to date, and I know this gets a lot of people anxious about the vaccine and possible allergic reactions, but if you think about it, to date, out of the thousands and tens of thousands of people that have gotten the vaccine, so far there have been 4 cases of severe allergic reactions. All 4 cases have recovered, including the 2 in Alaska, without any issues or any complications. And so again, when you think about the vaccine, look at the benefit of getting a vaccine versus the risk of not getting a vaccine and getting COVID-19, and weigh those options, because right now they're pushing the vaccines out very quickly. They're going through phases. Right now the phases are for healthcare workers and those in long-term care facilities. Next phase more than likely is going to be essential workers. Phase after that is going to be those above the age of 65 or with underlying health conditions that put them at higher risk of developing COVID-19 complications. And so you can see over the next few months, things are going to accelerate fairly rapidly. Now, with Pfizer, there have been fairly smooth distribution. There have been a few hiccups like we expected. Moderna's is going to start probably distributing over the weekend or into Monday. My guess is if it mirrors what happened with Pfizer, people are going to start getting shots in the arms with the Moderna one on Monday. And one of the big questions I constantly get asked is, which one should I get? Should I wait for one or wait for the other one? Is one better than the other one? And right now, looking at all the data, listening to the VRBAC experts meetings, these 2 are almost equivalent as far as the effectiveness. Moderna is 94.1, Pfizer is 95%. The side effects, they both had fairly mild side effects. Injection site issues, which is arm soreness, redness, maybe a lump, fevers, fatigue, headaches, muscle aches, those typically went away within a day or a day and a half for most people, and they were treated well with Tylenol or acetaminophen or ibuprofen. And so, again, the profiles look almost identical between the 2. Now, one big difference is the way they're stored. Now, with Pfizer, it has to have the ultra-cold storage. It can stay out of the ultra-cold storage in refrigerated temperatures for a day. With Moderna's, it can stay at refrigerated temperatures for 30 days. So it's going to be much easier to get it to those remote rural communities, and that's going to help with distribution. Plus, with Pfizer, U.S. has agreed to buy 100 million doses. They try to get an extra 100 million. That's not going to happen for a while with Moderna's. They initially agreed on 100 million, just exercised an option for a second 100 million. So we're talking between the 2, 300 million doses, which is 150 million people because they're both 2-dose vaccines. And so over the next few months, probably into springtime, that's when most people will be ramping up and getting their vaccines. Another difference, Pfizer, you take one at day 0, one at 21. With Moderna, you take one at day 0, one at 28. We'll see what the CDC says. With Pfizer, what they said is you can get it. There's a 4-day window. So 17 to 21 days is when you want to get it after you get that first dose. So day 0 and day 17 to 21. But they also said if for some reason you can't get it in that window, because things happen in life and you might not be able to get it in that window, then they said get it as soon as you can, but you don't need to repeat that first shot. So let's say you get a shot on day 0, day 21 you can't get it, but you can get it a week later. Go ahead and get that a week later. You don't need to repeat the whole shot sequence. Just get the one like you're supposed to. The other thing they found out, and I've gotten this question a few times too, what about effectiveness? Well, we know with the Pfizer one, and we'll find out from the FDA one, with effectiveness, with the Pfizer one, it looked like in a study there might be some effectiveness after the first vaccine. But that 95% came after the second vaccine. They directly asked Pfizer and the researchers, and the VRBPAC independent researchers looked at it as well. And they said, we really don't know because it wasn't studied that way. It was only studied after the second vaccine because we were seeing that high level of effectiveness. Bottom line is you need both vaccines because you want to get that full effective, you want to get as much effectiveness as you can out of the vaccines. And so that's going to be extremely, extremely important. So today we expect the FDA to issue their emergency use authorization for the Moderna vaccine. Tomorrow, the CDC ACIP, which is the Advisory Committee on Immunization Practices, is meeting to recommend who, what, when, where, how, all those things that I as a doctor would need in order to give you a vaccine. Who should be getting it? How often should they be getting it? What dosing should they be getting it? Those types of things. And kind of the nuances of the vaccine. How are they made? How are they mixed? How long do they have to be refrigerated? How are they given to people? That type of thing. That information, the specifics are what the CDC works on. So ACIP, that advisory committee, will meet and decide on that. They'll give the recommendation to CDC, who more than likely will sign off on it. That'll probably happen tomorrow, Saturday. And then over the weekend, it'll be distributed across the country. Now, we talked about Pfizer. Between 300 and 400 distribution sites. With Moderna, it's going to be a few thousand distribution sites, so it's going to be much larger distribution, at least initially. And so we'll see how that rollout goes next week. Now, again, one of the big questions I get is, again, should I wait for it? And my advice is always the best vaccine you should get is the one you can get, meaning don't wait for one to come along when the other one's readily available, because every day you wait, every week you wait during the pandemic puts you at higher risk of getting coronavirus, getting COVID-19, and getting complications from it. And then just real briefly, looking at the numbers, we know numbers are crawling higher, or not even crawling, they're climbing higher and higher very rapidly. We're getting up against 250,000 cases a day here in the U.S. I don't think any of us thought we'd see that at this stage, but we're seeing these super high numbers. Looking at it here in the U.S., since the pandemic, 17 million cases, 292,000 deaths. Just here in the U.S., worldwide, worldwide 1.7 million deaths. And so this thing has really, really expanded recently. Part of that has to do with the holiday season and our travels. We knew Thanksgiving, we see a bump in cases. We're seeing that now. The concern is this is going to bump up against the holiday travel for December, and this might perpetuate into January. And so we have to be very careful. Again, the advice is if you don't need to travel, don't travel. Only essential travel. Do things remotely with family and friends. I know we all want to be around family and friends, but now is the time to celebrate remotely with them, with the eye on next year. And I was just on the Today Show talking about this, how, looking forward to next year, I think one of the big things we're going to realize is next year, around this time, we're going to be able to celebrate with all our family and loved ones we couldn't celebrate this year. So it's going to be a double celebration, and it's going to be a wonderful time. We just need to make sure we get to that point, and we all get to it as healthy as we can. So let me see if you have any questions now.
If I've already had the virus, should I get the vaccine?
So if I've already had the virus, should I get the vaccine? And that's a fantastic question that a lot of people are asking, and the experts actually answered the question. Overall, the question is yes. If you've gotten the virus, you should get the vaccine for a very specific reason. If you've got the virus, we call that natural immunity. We have no idea how that natural immunity is going to work in your body. We have no idea what level of natural immunity you need to protect yourself from coronavirus. And we have no idea of how long that natural immunity will last, how long it'll give you that protection. What we do know is when you get the shot, looking at these two, 94.1 or 95% effective, it's going to give you a very high level of protection, and we think that high level is going to last for a while. They'll be looking at that over time, determining when we might need other boosters, but right now they're thinking years in the future is when we'll need those. So you'll need to get a shot whether you've had COVID or not. But the CDC did come out with some recent information saying when you have COVID, there's a 90-day window after you recover from COVID. There's 3 months where you seem to be protected from getting COVID a second time. Just 3 months though. So what they are saying is if you want to delay your vaccine for 3 months so you can save the vaccines that are out there, because there are limited numbers for those who might need them more than you, then you can do that. But just remember, at the end of the 3 months, you need to get your vaccine. This is not a don't get a vaccine message. This is a you can delay it 3 months if you had COVID. But that means recovering from COVID today, I can delay it for 3 months from today. If I recovered from COVID 3 months ago, then I need my vaccine right now. And so again, they're saying you can delay it for 90 days after recovering from COVID, but you definitely need to get your vaccine after that.
When is it expected when children will be getting vaccines?
So children, that's always the big question right now, children and pregnant women. And let me start with pregnant women first, because I failed to mention that early on. So with pregnant women, what the advisory committees looked at and what the FDA decided on is pregnant women, they're putting out the advice, the information. Pregnant women were not tested in the human trials. And that's very typical for human trials. They get tested subsequently as they start going through the adult human trials and making sure it's safe, giving it to adults, making sure it's safe, and then testing it on women at some point. And at that point, they can say, we tested it on pregnant women and it's safe. However, they were not able to do that this time because they're just barely getting through the trials and getting this emergency use authorization. So what they're saying is, since we did not test it on pregnant women, we don't really know the effect of pregnant women or their fetuses. We don't know the immune response in pregnant women, as in will it give them protection. We don't know if it'll protect the fetuses. So when they're born, they have protection. There's a lot we don't know about this, but the safety profile looks pretty good, and they can, what the word they used was extrapolate. They can extrapolate and say, we think it might work fairly well for pregnant women as well, but we can't say for sure it will. So here's a recommendation they came out with. If you're somebody who's at high risk for getting coronavirus, and then your turn comes up to get the vaccine, as in right now it's healthcare providers. So let's say you're a nurse in the emergency room and you're pregnant. They're saying that you need to talk with your doctor and make an informed consent based on the risk-benefit profile. So in other words, is the benefit of me getting coronavirus, or me getting the vaccine, more than the risk of me getting coronavirus and the issues we know can cause for the pregnant mom and for the developing fetus. And so making that informed consent is extremely, extremely important. Now, looking at children, Pfizer vaccine, 16 and above. So it's covering those 16 to 17-year-olds. Moderna vaccine, 18 and above. So it's not covering those 16 to 17-year-olds. Right now, Pfizer and Moderna are both studying children 12 to 17, and those studies should be done over the next couple months. And then they plan on moving to 5 to 12-year-olds and studying them, and that'll be done over the next few months as well after that. So what they're saying is they're hoping to get this information out and to get emergency use authorization for children by the summer, end of the summer. So going back to school in the fall, they're protected. But time will tell where they go with that. Now, as far as children under that, that'll come after these two phases of children 12 to 17 and then children 5 to 12 and then eventually children younger than that. So that'll come eventually, but right now they're focusing on those two aspects. And so that's where we stand with children at this point.
Dr. Torres, are you getting the vaccine?
Definitely getting the vaccine. I am definitely getting it. I talked with Colorado Department of Public Health. I'm in Colorado right now, a town called Monument. And so I need to fall in line with where I typically would fall in line if I wasn't on TV. And so I talked to them about my particular circumstance. I volunteered at a homeless shelter. The homeless shelter is opening back up. They're bringing doctors back in once they've gotten vaccinated. And so my vaccine will be what we call the second phase. Here in Colorado, they did things a little bit different. This brings up a good point. So the CDC came out with information saying healthcare workers and those in long-term care facilities are in phase 1A. Those are the ones that need to get the vaccine right away. And then they left it up to the states how to do that. Some states said, let's have a lottery system because we don't have enough vaccine for everybody, or some hospitals did. And here in Colorado, they did something a little bit different. Yesterday, I talked with Jill Hunsaker-Ryan. She's the executive director of the Colorado Department of Public Health and Environment. And what they did, which I think is pretty ingenious, is they said, let's get healthcare workers who directly have contact with COVID patients for 15 minutes or more a day. And those are the first ones to get it. And then the second tier will be long-term care facility residents. And then the third tier will be other healthcare workers who don't have that direct contact with COVID patients, but could be exposed to COVID through their patients. And so I fall into that third tier. Talking to her, it looks like I'll be getting it probably over the next 2 or 3 weeks once they get through this first salvo of who they're getting it. But when my turn comes up, I'll be definitely getting the vaccine. And like I mentioned, as far as the vaccine, which one to choose, the best vaccine is the one you can get. So I'll be getting the one that's most readily available to me and then following up with my second shot. But safety profile looks great. And I know a few months ago I talked about, we're going to look heavily at the safety profile. I'm going to look at it. I'm going to talk to experts, which I have, and make sure it's safe and effective. And at that point, I'll say, yes, we're good to go. I want to get it. And we are at that point with these two vaccines. Subsequently, we'll find out with other ones. Johnson & Johnson is going to probably be coming up in mid-January with their data and seeking their emergency use authorization. So the ball is rolling here, and we are starting to see that light at the end of the tunnel. Remember, the vaccine is just one tool to get through the pandemic. We're still going to have to wear masks. We're still going to have to social distance. We're still going to have to wash our hands until we can get this pandemic under control. And to answer one of the other big questions I get, will this virus go away? The answer is No, the virus is not going to go away. If you think about the history of mankind, we've eradicated one virus, and that was smallpox, and that took decades of efforts to eradicate. Other viruses, and viruses are just tricky and hard to get rid of. If you look at measles, if you look at mumps, if you look at these viruses, they're still here. We don't get rid of them, but we control them with things like the vaccine. And that's the same thing that's probably going to happen here with coronavirus. It won't go away, but it'll be controlled. There'll be outbreaks every now and then. And when we have those outbreaks, more than likely, we'll resort back to the masks. We'll resort back to social distancing, at least in those pockets of the outbreaks, and then vaccinate the people who haven't been vaccinated. That's probably what we're looking at going forward. But again, looking at the headlines, thank you for your questions. They're always fantastic. Looking at the headlines, VRBPAC met yesterday to advise the FDA, yes, we should go ahead and get an emergency use authorization for the Moderna vaccine. ACIP, which is the advisory committee for the CDC, is going to advise the CDC, and then tomorrow they'll probably come out with recommendations on how to do that. FDA will probably give the emergency use authorization today, and then Moderna will start shipping out shots in arms on Monday. Pfizer's already doing it. There's been a few stumbles, but overall it's been a great success getting those shots out there. And remember, there's hundreds of millions of people that need these vaccines, and so it's going to take a while for everybody to get them. In the meanwhile, do those things I was talking about to stay healthy and keep those around you healthy as well. And then remember the holidays. I hope you have a fantastic holiday season. But remember, you need to stay safe during the season. You need to keep your family, your friends, and your loved ones safe as well. But over the weekend, as you're preparing for all upcoming holidays, I hope you stay healthy, hope you stay happy, hope you have a great time. Thanks.